national partners are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.
Good morning, everybody. Thank you so much for joining us at another health hour. I love the music of the introduction. It always makes me a bit, bit ready to go. So I hope you're all ready to listen to an excellent speaker who's been here before. It's Dr. Chiedu. He's a dermatologist and he's here this morning to speak to us about the topic of hair, which is really important. I know our crowning glory, that's what someone told me once. But we know that Black hair especially is prone to lots of different problems, dryness. So he's going to talk to us today about the best way to look after our hair and our scalp. Now, if you've got any questions, as usual, for those of you that join us on a regular basis, will know that you can pop them in the chat. If you have any private questions that maybe you feel a bit shy about asking yourself, you can pop them directly to me and I will ask Dr. Chiedu the questions on your behalf. This usually works by Dr. Chiedu is going to give us a presentation and then there'll be an opportunity to ask questions. But I'm really looking forward to your talk. So over to you.
Thank you so much, Dr. Ngozi. Okay, good morning, everybody. I'm going to share my screen now, and hopefully this will make it nice and easy for everyone. Brilliant. All right. Okay, so good morning. So today, my name is Dr. Chiedu. I think I've been here now, this is maybe my third or fourth time coming through. So it's a pleasure to join CAHN. And today we're going to talk about hair care considerations in Afro-textured hair. So as many of you guys know, I'm a dermatologist registrar, but I do some research in it's often called skin of color, but I call it diverse backgrounds. Okay, so as we continue. So for this talk, there's no declarations of interest. Some of the information with hair care is anecdotal and based on clinical experience. So if you go look in literature or you see speak to other healthcare professionals, they may have different experiences and that's fine. Skincare is very personalized and therefore sometimes you do have to tailor your care and your management to that individual. Okay. My hair is not my identity, but my crown, and that's such a common phrase that we all know and live by. Our hair is our identity. And, for many of us who love music or enjoy the arts, hair is often a reference that we use. I identify two good albums or good songs really that kind of embody that a lot. So today, along that kind of line of trying to optimize and look after hair, we're going to talk about good hair practices. We'll talk about a few common conditions that we as dermatologists do see, but also that affect the Afro-Caribbean population in general, and also people worldwide. Okay. Now, so in terms of hair management, Okay. When we think about your hair, like your hair isn't alive. Your hair is very much kind of gone past that stage of growth. So of living, should I say? So really, when we're thinking about washing our hair, it's really an opportunity to deep condition and moisturize, add more moisture to the hair. Depending on how curly your hair is, the thickness of your curls will often influence how we how you manage your hair, and there's a lot more flexibility when your hair is looser and has a looser curl pattern. Quite often we've talked about type 1s, type 4C hair. Now I think there's a lot more discussion to move into probably like an 8 category kind of belief. And that's because there's so much variations, particularly in the Afro textured hair spectrum. And so it's important to appreciate that, although even within the same household, same family, you may have two different coiliness, two different hair textures, and so how one person manages the hair may be different to the others. Okay, so what I want to do first of all is just kind of give some general rules of thumbs about washing hair and managing hair. Okay, fundamentally, your hair needs to be washed at least once a week. And that's hard to say and hard to hear for many people. I can see some of you, I imagine some of you thinking, what do I know? My hair is quite short. I've grown my hair out before, so I do know the struggles of hair care and the time it takes. When your hair is, so I guess the principle of hair care is to kind of get rid of all the buildup and residue that's been in for the whole week, the whole time. Now, when your hair is straight or not as coiled, you're able to use sebum, which is that kind of natural hair oils from your scalp that moves down the natural shaft of your hair. This helps lubricate it, helps keep it moisturized, keeps moisture in. But also that means that you've got more chance to bring in make it more greasy, and obviously that brings in the environmental dirt and build up of all the products you use. So often you can wash your hair every other day with deep conditioning once a month. Is enough to keep your hair hair healthy. And once a week doing a light protein treatment again, just to build up the resilience and the strength in the hair shaft. In curly hair, that's leaning towards more the Afro textured hair. We know that washing it too much is probably going to over dry it, because naturally this hair is naturally more drier due to the fact the sebum isn't able to really coat the hair follicles as well. But we know that if you don't wash your hair as much, it's going to lead to more buildup on the scalp. It's going to lead to increased risk of fragility and increased dirt and knotting and all the kind of complications that we try to avoid day to day. So we often say wash your hair once a week, and follow that with deep condition, with every wash, and a protein treatment as well once a week. When you finish your hair after you've done the conditioning, you wash out that deep conditioner, you then finish it with light oil and then maybe a leave-in conditioner as well. Now, when we talk about conditioning our hair, there's two ways. So often people will use a deep conditioner and put it in the hair and then leave it for 30 minutes. Some people prefer the heat. I personally don't have time to use heat, so I have to usually put deep conditioner in and walk around my house and then come back and wash my hair. But people will a low heat or gentle heat can often help with that conditioning process. Okay. Now, what about products to use? Generally for shampoos, we like the sulfate-free containing shampoos. They tend to be quite effective and do a good job. We intermittently, especially in the lightly coiled or more straighter hair types, you can use a sulfate containing shampoo. We tend to say either alternate them, so maybe one day use the sulfate-free, then use the sulfate containing, or at least for the majority of times, about 75% of the time, you're going to use sulfate-free. In Afro textured hair, if the shampoo that you prefer has sulfate in it, just maybe consider one that's a light, contains gentle sulfates or a light concentration of sulfates. In terms of oils, we often think about jojoba and argan oils as kind of the ones that typically mimic or closely mimic the natural sebum that we produce. They, to me, work really well and effectively. They help actually give some more vitality to the hair. Coconut oil, avocado oil, castor oil, all good alternatives. Castor oil, especially the drinking about castor oil, can often be quite thick and quite heavy. The can works really well actually for for those people who have like those tightly coiled hair. Let's keep that moisture in. Then we talk about this idea of liquids and creams. Liquids really, in some ways, see as a primer to help moisturize, add moisture to the hair. Then the oils and the creams to lock it all in, keep it all tight. And often you can use that from just the water from the shower or spraying water or leave-in conditioner spray. And then a cream is typically your kind of your leave-in conditioner or your detangling cream or butters. And quite commonly we think about shea butter, whole-tight hyaluronics. And that's quite a natural thing to do to help really maintain the moisturizing the hair, sorry. So that leads us to this commonly used terminology called LOC, liquid oil cream. And that can be typically, like I said, that's your spraying to prime the hair, get the water on it first, and then get the oils and the creams to lock it in. Now, you can use liquid oil cream, liquid cream oil. It depends on what your preference is, but that's just generally a good way to kind of maintain the hair moisture and allow you to be more flexible and play with it or style your hair as you wish to. How long does that take? Well, I went to a lecture by a dermatologist from Chicago, and she was kind of to explain to me that a hair like Afro-textured hair, if you want to do it properly, you want to wash it properly, can often take about 4 to 8 hours to do, and that's a lot of commitment. So I appreciate that not everyone's going to be able to do that. So what we do generally encourage is to find that happy medium of what you're able to do. And I personally quite enjoy just using I use a leave-in conditioner spray and a leave-in conditioner cream during the week just to keep my hair hydrated and moisturized. I appreciate my hair's out and my hair is quite short now. But for you may find that if you find a leave-in conditioner spray that just allows you to just keep the hair maintained during the week and then you're able to wash it the weekend, that's fine. Okay. So what about supplements? Because the main rule, and any doctor will tell you, the main thing to do is eat right. The food that you eat is going to fundamentally influence how well you feel and how well your body does. Okay, so your diet is really important. We know that 2 main supplements that have a massive or have a good influence on hair care, hair maintenance is vitamin D and iron. For many of us, we're often vitamin D deficient, and that's typically because we live in a low sunlight environment for our skin types, where we need to metabolize and make vitamin D through the sun. So a good vitamin D supplementation is often an effective way to get things in. Iron, for many people, they have low iron. So we often encourage good iron supplementation, not too much. So just be mindful, just check where you are. If you think you've got low iron, particularly if you do menstruate, have periods, then iron supplementation may be effective for you. Other things we think about being more holistic is to sleep well, eat well, strive for a good work-life personal ecosystem. And everyone has their own different ratios, but it's important to have time to recharge, to kind of reduce those stress levels, and get the positive endorphins you get from spending time with loved ones, families, building those relationships that allow you to express the parts of yourself that you don't often see at work. Now, how about protecting your hair? Now, obviously, Mario and everyone else has talked about braids and different types of hairstyles. And then Solange tells you not to touch my hair. And they're both of them quite correct in some ways. Obviously, the more people touch your hair, the grease you can get, the dirty you can get, then the need you feel to wash your hair quite often. And then we then think about the time it takes for us to manage our hair in terms of the shampooing, the detangling, the plaiting, and just getting the style of the week. So we often think about braids, dreadlocks, cornrows, and then perhaps we think about either relaxing or texturizing. Now, all these actually are safe to do, and I know there's been a lot of public discourse and conversations about relaxers for a long time, and now braids, but the evidence demonstrates that they're all safe and good in moderate use and good and sensible use. What I would when we're talking about braids, I think the main thing that I want to emphasize is that braids should really be kept in your hair for about 4 to 6 weeks. Ideally 4, but I appreciate they're expensive to do, so push it to 6. But any longer than that can actually cause more damage than good to your hair. Now I've kind of identified 2 main braid styles. I know there's many others, but the 2 I want to really talk about are the crochet braids and the box braids. So if you have a history of tractional alopecia, then I suspect crochet braids are probably better for you because they reduce the tension in your hair. Whereas box braids are good, and they are obviously have a bit more flexibility, but they do have a bit more tension to the hair. So that's something that we try and avoid if you have a history of tractional alopecia, or if you do have a history of tractional alopecia and you want to use it. Again, just mindful how thin you're doing your braids, and secondly, how frequently you're doing them. Natural hair, to do it well, requires commitment to routine. And that's fundamentally the case. So there's many people who've gone from relaxing the hair all the time, and then they want to go back to a natural hairstyle, so no chemicals, no chemicals, just using natural product, natural products, shea butter, and all natural products, or a natural kind of outlook. Fundamentally, it's not really about the style that you use in most of the time. It's really about how good you are at committing to a hair care routine. Now, if you're a busy person and you don't have the time to do that all the time, then you need to think about what can you do, and what time do you have to do. And so that may be that you do more of a kind of cornrows, or may wear a wig or a hairpiece, or you prefer to get into braids, and just having someone being able to just lightly manage your hair, and then when you go on a holiday, then take it out and have it free and afro in nature. Texturizers do make your hair easier to do, and texturizer isn't necessarily completely relaxing your skin. It just loosens up those coils to allow you to really manage and maintain that hair in a way that's a bit more easy for you day to day. But fundamentally, the main message I want to throw across here is you just need to commit to a good hair care routine, and once you have that in place, your hair will tend to do well, irrespective of whatever you're using. Okay, so that hopefully is a brief overview of hair care management, hair care, and how to really think about washing and maintaining your hair in general. I haven't dropped any products in there, basically for 2 reasons. A, I'm not being sponsored, and B, everyone's different, so you need to find the product that works well for you and that does what you want it to do. There's no point me saying, oh, get this and get this and get this, because fundamentally it may not work for you as well as it works for me. And that's because of different reasons, as I mentioned before, including the idea that my hair coiliness is probably different to yours, or it's probably different to your brothers or your sisters, etc. So explore, have a think about what you're doing, but also just remember that how it works for you may not work for the next person, and vice versa. So seborrheic dermatitis, very common. We all see it. Probably we've all had it at one point in our lives. It falls under this kind of spectrum of dandruff, which is quite mild, and then cradle cap is what we often see in children. If you go to a GP or go to a dermatologist, they'll often prescribe you ketoconazole shampoo. Okay, and ketoconazole shampoo works by reducing the yeast, which is naturally on our body, and that causes this flakiness, as you can see on the bottom picture, and also in dark skin types can often lead this kind of lighter pigmentation that we see here. Okay, all this is reversible with good care. Now, ketoconazole shampoo is great. It works so well, but it can dry the hair out a lot. And so with afro-textured hair, we have to treat a bit longer and treat a bit more smartly. So we often say that ketoconazole shampoo, you have to leave it in your scalp for about 10 minutes. Okay, not your hair, it's your scalp. Okay, and after that, you wash it with your normal shampoo and then your normal conditioner, and you finish off your hair care routine. Other things that we may prescribe you whilst you're in the hospital and clinic is called corticosteroid or topical corticosteroids. That's just to help reduce that inflammation that's often associated with seborrheic dermatitis. There's also topical immunomodulators, and these are things often known as Protopic or Elidel. And these aren't steroid, but they work in a similar way in terms of reducing that inflammatory process. But compared to steroids, they tend to be slower in action. So we often may suggest that after we've got the inflammation under control. In cases where it's quite significant, so say you've got quite an area, not only your hair, but your face, and you maybe have some patches of hair thinning, then it may give you some oral antifungals, and that can help really bring the yeast down and allow you to recover and reduce that the flakiness that we're seeing below. Over-the-counter options. So you actually can get ketoconazole shampoo over the counter in Boots. I think it's probably about £10. Selenium sulfide containing shampoos with salicylic acid are effective actually, because sometimes seborrheic dermatitis, we can get these like thick white scales and flakes, and so the salicylic acid helps gently lift that off as well. Shampoos containing tea tree oil and pyrithrone zinc. So pyrithrone zinc is often seen in Head and Shoulders, but other anti-dandruff shampoos, tea tree oil as well, can work as well. So I think the one thing I would say about treating dandruff and seborrheic dermatitis is that when you put it on your scalp, you need to leave it on for more than like a minute. You know, you need to give it time to work. So talking about 10 minutes really, and if you can't hold that long, maybe 5 minutes. And I generally advise when you're washing it off your hair, just maybe get some on your hands as well, just to wash your face as well, because often seb derm can often affect your nasolabial fields as well, and so we just kind of want to do a good clear out of that total. When it's really scaly, you may want to put some coconut oil initially, or some Vaseline or Hydromol, just to soften the scale and just lift. So that means when you do wash it off, it's more you get more of a clearer well, there's great clearance of the flakes and the scale. Gout psoriasis, so very common. It's something that affects many people, and we think about it when we see often on our arms and our legs and our bodies, but it can affect the scalp a lot. And again, we see this kind of purplish patch or plaque, we call it, with kind of a white scale on top of it. It can be quite itchy, it can be quite irritating, and it can often lead to some areas of hair loss as well. Again, you can see it on this gentleman below, and here it's more subtle. So it's very pink, but you've got some white scales on there. Again, with psoriasis, what we're trying to do initially is to remove the scale, remove the thickness, and that's with the thick emollients, such as Hydromol, 50/50, white soft paraffin, liquid paraffin, coconut oil, coal tar based products such as Sebco and Capsule shampoo are often effective as well. And then once we've got rid of the scale, we need to kind of calm that inflammation down. That's when we use steroid-containing products, which can be a plain old topical steroid. It can be one that contains vitamin D analog, or one that contains salicylic acid as well. And they really work quite well together. And if you do that in a good routine, then we can have they can often lead to a good effect and maintain scalp psoriasis. Okay, ringworm, big issue for everyone who likes a good clean shave. So it's not just the Black community, Afro-Caribbean community. If you like a low fade, then there's a risk you may get it as well. But this is because commonly we associate it with going to the barbers. You can get it from other reasons too. It's very common in children. It's ringworm that you see on the body, the same ringworm that you see on the scalp. Scalp is hard to treat, so it's important that if you notice any kind of hair loss, or if you notice kind of maybe you've got some inflamed lymph nodes around the back of your neck, then it's good to go to your GP and for them to have a look. Ringworm fundamentally on the scalp needs to be often treated with tablets, so antifungal tablets, and that works really well. If it's very mild, and then maybe antifungal shampoo, such as ketoconazole that I mentioned before, will be effective to capture it early, but most times the antifungal tablets are needed. When going to the barbers, and this is the main message I want you guys to take home in terms of ringworm, is just make sure before they put that clipper to your head, is that they've sprayed the barbicide and clippercide on, and these are antifungal, fungicidal, so they kind of kill the fungus, any kind of fungus on the blade, and that prevents kind of transfer. Avoid sharing hair towels in general in the household if you can, and if you share hair tools, and just generally, it's good practice to clean them afterwards and make sure that you're not cross-contaminating where possible. Okay, and so we move on to acne keloidis nuchai, AKN, or folliculitis keloidis nuchai, and this is something that all affects many men and many people who like a good clean shave, and these are just basically where we irritate the hair follicles and lead to papules, these kind of bumps of inflammation. And if we don't let that resolve, obviously it can get more inflamed, and that can lead to great scarring, and then you get these kind of raised bumps, or I was gonna call them nodules really, but I don't use medical terms, and this can be quite, obviously can affect people's confidence, and it can affect people's self-esteem. So now AKN is actually relatively hard to treat because we just haven't done too much research on it, and there's some general rules of thumbs which I try to encourage most of my patients to consider. So after you've had a haircut, you use gentle exfoliating cleanser around that area, so maybe around the bottom of the hairline, around your beard, and that can help reduce any ingrown hairs that may produce. Light moisturizer is effective, and often after you've had your haircut, you might feel a little bit irritated, so avoid scratching where possible. If it's an issue and it's caught early, a good topical steroid can be effective, and that's often you'll need to go to your GP or dermatologist for that, because we need to use a moderate to potent steroid just to capture that inflammation really quickly. I would say try and avoid a close shave. So I often go, when I go to the barbers, I will go for a 0.5 rather than a clean shave. I know that not everyone likes that, but if that's the case for you, then just try and modify how often you're doing it, or at least try and use some of these gentle suggestions to minimize the effect of getting those bumps. Fractional alopecia. So we talked a little bit about this, and I really just want to just briefly mention that it can occur at any age, and it's if you're experiencing pain and itchiness around your scalp after the hair has been done, then it's probably too tight. Okay, hair care. Yes, I know we don't want to do our hair that often, but if it's painful at the time, that's probably causing an injury, and we can prevent hair loss by not doing it. And if you notice your hair's thinning around the area, then you can probably stop having tight hairstyles, and quite quickly it can recover. But sometimes if you continue and persist, it can lead to scarring and permanent hair loss in that area. Touching alopecia is not only just about the pain, about when you're doing the hair. It can also be about the weight of the hair as well, so and the size of the hairstyle. So if it's really thin braids, then the risk of that. Sister locks, unfortunately, there is a risk of that as well. But again, just try and think about what works, what you're trying to achieve with your hairstyle. There are treatments for this, but you often need to see your GP. Topical minoxidil has been effective, but again, I would probably suggest you speak to a dermatologist before you start that. Okay, so this is the final run really, and I just wanted to talk about other forms of alopecia because I know we haven't really talked about that too much here. And when you think about alopecia, we think about non-scarring and scarring alopecia. I'm not going too much about these. I'm just going to give you some headline titles about them. So a non-scarring alopecia, the most common one is kind of androgenic alopecia. So this is just male or female pattern baldness, and that's common. That most people will get that at some point in their life. Often it start depending on your family genetics, etc. You may start at different points. It can't be avoided, but there's obviously by doing the good hair routine, you can delay or at least the visual nature of it can be modified and managed more gradually. Alopecia areata is an inflammatory hair loss, inflammatory condition. It's autoimmune, so you get these patches of hair loss that may often recover, but it's often the scalp. But you can also see like hair loss in your eyebrows and other parts of your body as well. Telogen effluvium. So this is one that many people experience without realizing it. So you may experience a period of stress or illness, or you may have had some certain medication, then you know some excessive hair loss in the shower. So you're washing your hair, suddenly there's clumps coming out, you didn't realize coming out. This is temporary and transient, and often after a while, it will just resolve itself. And then finally, the one that probably we talk about, but patients don't really appreciate, is trichotillomania, which is basically where people get stressed and they pull out the hair. And that's quite common. That's quite hard to treat, and often we need to do something called psychodermatology, which tries to work on the mind-body brain skin axis. Scarring alopecias, these are things which are quite traumatic for many people. Obviously, we mentioned how much hair is your part of your identity. CCCA, central centrifugal sacral alopecia, is often seen in the center of the scalp and then spreads out. It can happen at any age, typically in the mid-30s upwards. If you're thinking that your hair is thinning around the area, around your crown, then it's a good opportunity to go to your GP, go to your dermatologist. Often your hairdresser may say that, oh, it's suddenly your hair's a lot thinner or a lot less dense around the area. That's probably a point where you can go see your GP or dermatologist. Now, I'm going to appreciate that someone will tell me that they made refer to the GP and it's a year to see a dermatologist. Unfortunately, that's the case. And the only way around that is private dermatologists, which I appreciate expensive, but there's really nothing else we can do about that in this current ecosystem of the NHS. Bone fibrosis and alopecia, again, is very similar, but typically we find it affects the front of the hairline first. And in men, you may see patches in the beard, and then both men and women, you may see kind of patches of hair loss on the eyebrows. Lichen planopilaris, very similar to everything else I mentioned before, but you often may see some purplish rashes on your arms, legs, etc. It can be more itchy, it can be a bit more irritating. Again, and these are kind of signs, if it's persistent and some patches of hair loss there, signs to go to your GP, go try and get a dermatologist appointment. And finally, lupus, cutaneous lupus, discoid lupus, it's an autoimmune condition, and I'm sure within our community it is relatively prevalent. So you may know someone who has it. You may get initially some patches on your body, and then suddenly you may notice you getting some soreness and red marks in your scalp. again, it's hard to treat, but we can treat early means that we can reduce the risk of scarring and prevent and allow you to regrow your hair. Okay, so sorry, I should mention that scarring alopecia means that you can't regrow the hair in that area. Non-scarring alopecia means that the hair will come back in that area. Okay, and then closing remarks. Hair is, it's part of our identity. It's something that we have done throughout time. We often learn our hair care management from our family, from our friends, and it's generationally passed on. It's so personal to you that going to your healthcare professional who may not be from your background or your community you may find that like a mental block. What we've learned to do, at least what we're trying to do, is especially in the new generation of dermatologists, is to marry the social and kind of your not cultural behaviors of hair care with kind of the medical management as well. So speak to us, have any questions you have, explore any questions you have with your dermatologist, and really try and find a solution that works best for you. Okay, and with that, I'm going to stop, and hopefully we've got time for questions.
Thank you. Yes, we do have time for questions. We've got about 20 minutes, and there are quite a lot of questions in the chat, but thank you so much for your presentation. So I'm going to start off by asking, there are many related questions, so I'm just going to try and summarize some of the topics, and I've had some direct questions to myself as well. So there's quite a number of questions about single plaits. I think that's one of the commonest hairstyles that people do. What would you recommend about synthetic braids? What do you say about the synthetic hair causing problems?
Yeah, so sorry.
Yep, go on.
Yeah, so I think this is more recent. This has happened over the last few months or so, where there's been a few articles that suggested that suggested synthetic braids may cause cancer or everything else. I think the paper is actually incorrect. They are safe to use, and the amount of exposure you need to get kind of cancer from this is way beyond the amount what you really experience from doing your hair. So they're fine to use. Again, so they're fine to use basically. The other part I'd say in terms of thin single plaits, the smaller the plaits, it means the greater tension on that area of hair. So thicker plaits are probably better, but then there's a balance between not making too thick that's too heavy to carry, and just think about how easy to maintain. But I generally would advise that thinner the plaits are, probably the shorter time you have to keep them in. You can keep them in.
Okay. There's also a specific question about Brazilian wool hair. Do you know that one? We're getting to specifics now.
I unfortunately,
No.
Brazilian wool hair is beyond me.
But while we're on the risk of cancer, I
Yeah.
have seen over the years many things, and the text that you get say that relaxing hair causes cancer. Can you talk about that specifically? Because I know it wasn't.
Yeah. So again, we had a good talk actually from a dermatology researcher, Dr. Crystal Agu, who's Nigerian but also based in America, and there's this idea when we think about relaxing hair, it's basically what we use to break the bonds, chemical bonds in the hair. And I think what people extrapolated was this idea that relaxing hair then lets you uterine cancer, and there was the thought of this causation, and so causation means that it causes the uterine cancer and other cancers, but actually that link isn't there. And actually, the many people who dye their hair, they have to break the bonds and make the bonds two times, right? So you break the bonds initially to make it blonde, or depigment it, then break the bond again to then add the color to your hair. So actually, there's more chemicals involved in dyeing your hair than it is in relaxing your hair. And there's no one's associating hair dyeing with getting cancer. So it's been an issue that has probably plagued the African Caribbean community quite a lot. But I would say that
there is no evidence.
no evidence. Yeah, no evidence.
I know that was my view really, but however, you see it quite a lot, and I thought it would be good to put that to bed. Does aging cause alopecia? Please say no.
Um, so age. So when we get older, we slow down. Our cells slow down, just like we all suddenly get less athletic. So it doesn't cause alopecia areata, but yes, your hair density will reduce as you get older, unfortunately.
Oh, blood blood pressure medication, and blood pressure medication specifically. And then there was another question related to that asked, what medications are associated with the hair loss? So we know the big ones are
Fine.
cancer ones
Yeah,
because
yeah.
that one's quite obvious. But does blood pressure medication?
Yeah.
I think there'll be lots of people listening to us now that are on blood pressure medication. I'd say keep taking medication. I know you want to look beautiful, but please
Yeah.
keep taking your antihypertensives. However, it'd be nice for Dr. Chiedu to clear that up.
Yeah, so far, at least from my understanding, there's no direct correlation between blood taking medication and hair loss. Minoxidil, which was actually designed for hypertension, is actually was found to grow hair, which is why that we use it, which is why it's used now commercially for hair. That's Regain, and it's often used for hair growth. But yes, we can make hair. We can give your hair piece if needs be, but we can't replace a life. So blood pressure management over your hair anyway.
There's an important question here about what can a woman use in her hair during the menopause to sort of reduce hair thinning.
So yes, you're right. So during menopause, your hair will naturally change, like just as your skin changes. Your skin is alive, guys. So by that I mean that every day it's been exposed to different things X, Y, around the world. So as we go through with our hormonal changes, such as we did when we were going from kids to getting acne, etc. Your immune balance changes, so there may be some hair loss coming through. I guess the main thing is to just have that good hair care routine. So the idea of when you moisturize, when you condition it, when you use shampoos, then that can often that can often maintain things. And then the period of where you may get some hair loss during menopause, it may recover. But if it doesn't recover, then it may be a case that you may just need to see dermatologist to see whether there's any underlying conditions. It might just be that you've got low iron and low vitamin D, and we supplement that as well. I think someone just mentioned back saying labeling on blood pressure medications states that some hair loss can be expected. Yes. So in when drugs go through trials and they get validated for public use, if a patient or some patients report an effect, then it's then included in the medical literature. So by that I mean, if some patients have reported that they've noticed that their hair was thinner, has hair loss, then it's reported within the literature, and therefore it can be seen as an association. I personally haven't had experience, or I'm aware of the experience of where blood pressure medication has directly been correlated with hair loss.
Okay. You've seen, they have all these multivitamins that are specific for hair and nails. Do they work?
I think they probably do have some benefits in terms of the kind of the vitamins and the minerals that you add that help with the kind of ecosystem of general good immunity and good health. But fundamentally, the strongest evidence for most of them are for vitamin D and for iron. But other vitamins have some association. But if we think about statistical significance, so this is what we use in terms of evidence base for justifying giving people treatments, then they probably are. It's not strong.
Now, there's two questions related to hair loss. One is about a young child who's lost all their hair, and secondly, specifically about hair loss of your eyebrows.
Yeah.
And
Okay.
what are things you can do to make that better?
Yeah. So alopecia areata can recover. Some people it doesn't recover. Some people it does recover. The main thing is each individual is different. There's some new medications out there that do have some good effects. We don't often give to kids that age, people that age. However, it can recover. So if you speak to your dermatologist, speak to your GP, they can often support you in that management. It depends on what caused your hair. Oh, sorry. Is the question about hair loss or growing more hair on your eyebrows?
Growing more hair on your eyebrows.
I think growing more hair on your eyebrows is very much dependent on your genetics. So if you're naturally meant to be quite fair and low density in your eyebrows, that's the case. Just draw some more on if needs be. I think it's probably the safest option to do.
Okay. There's a comment here about why wasting energy trying to restore hair where there is baldness. So I think maybe this person's just saying, own it, own your baldness. But one of the questions I was going to ask, not in the chat, but I'm going to take the host prerogative. I see lots of men that go and have the
Hair transplant.
hair transplants in Turkey.
Yeah.
I don't see lots of women. Is that because women can't do it, or is it just that it's just for male pattern baldness?
No, women do it. Women do
Women do
it.
it as well. Okay.
It's just you probably women do it earlier stages and do it more subtly. So when men tend to do it, the men tend to do it because it's so obvious. But there's often women who like bring the hairline forward a little bit more, or they'll take the hair from the back of the head and bring it forward. But you don't see it as much because women can hide it better with wigs, etc.
So where do they take the hair from? The hair from another part of their hair?
Typically from low back, from the low end of the hair, from the back of the head.
So if you're going to do it, you have to do it early, because if your hair if you're going not decide you want to do this in your 70s, it's a bit too late because everywhere doesn't have any hair.
Yeah. 70 is probably too late. But doing it too early means you probably have to do it again at some point. So Prince Harry allegedly had it. And so did Wayne Rooney obviously allegedly had it done as well. And you can see both theirs have now started thinning again.
Oh, okay. Oh, all right. There's a comment here about no research done in the UK about wigs, extensions, etc., but US has shown they cause harm. I think the evidence there is tenuous, but I'm going to let the experts speak. But I've had a look at many of these things as well. But go on, Chiedu.
Yeah, no, I agree. It's literally it's not strong evidence. You can put the challenge. So the challenge with anything you read, whether it's in the public media, such as in magazines and news articles, or whether it's in the scientific literature, is that it's contextual. So you need to someone can report this effect happened, but it may be in a small population or it may not be in a true environment. So we think about medicine in the real world and also in a secure environment. So quite often when we test drugs and build drugs, it's initially done in the kind of a controlled environment where we have the patients we want to see the effect in, who probably don't have any other condition, and then demonstrates the effectiveness of that drug. Now, if you then bring that person into the real world where they have a job, they have kids, they smoke, they drink, they party, they don't sleep very well, they sometimes eat fast food, they don't know everything else that happens in life, and then you give that same medication, you probably won't get the same true effect that you saw in the controlled environment. So when you think about when people are telling you that this product causes cancer or this product causes this, you have to ask, is that population similar to my population? Do they sound like me? Are they kind of my same lifestyle? is that the testing environment that I'm familiar with, and can I truly appreciate? Can I truly put myself in that scenario and see whether that effect will truly happen to me? Quite often you can't, and so that means that we often have to do that kind of real world analysis afterwards to demonstrate that. So it's important to appreciate that people can suggest things may be associated, but you need to kind of add context to that reality.
Yeah, and I suppose that's what it is, associated. I mean, you can associate lots of things, but a real proper randomized control trial, which is the gold standard within medicine, there isn't any randomized control trial that has demonstrated that yet. But you know, we understand your concerns. So there's another question here about, I had something that looked like scaling dandruff on certain areas of my scalp, and it's really itchy, and now it's becoming as if like wounds. What can I do to that? That actually sounds like some of the pictures you presented.
Yeah, so it could be, so it could sound like psoriasis. It could be yeah, so it could be psoriasis. It could be ringworm. It could be seborrheic dermatitis. It sounds
Need to get a looked at, isn't it?
yeah, basically fundamentally go see your GP and have a look.
Yeah, we advise that you go and have that get, because there's so many things it could be, and depending on what it is, will determine what treatment you need. It's probably best to go and get that checked out. Can hair be encouraged to grow through scouring caused by dermatitis?
Dermatitis is a kind of broad word that we use to describe inflamed skin. Depending on what caused the hair loss, depends on whether or not it can be the hair loss can be regained. If it's seborrheic dermatitis, then yes, in theory, it can be regained. And that's if you treat the inflammation early. So that's talking about the ketoconazole shampoo, the kind of selenium sulfide shampoos, all those kind of things. But again, if you think you've got dermatitis and you think that you've got some hair loss, see your GP, get them to speak to dermatologists. Often some areas of the country have what's called advice and guidance or teledermatology, where photographs can be taken, and then dermatologists can feed back to them.
Okay, there was a question here about something at the university. Is there a medical school in Manchester? Now, there's
Yeah,
only one medical school in Manchester,
yeah.
where the public can attend for treatments. Like they've got massage therapy, and the dental hospital provides treatment under supervision. So the sort of thing where I think what they're asking is there something where you can come and have maybe head massage or anything like that by medical students? So that it's, you
Yeah.
beat the waiting list and it's free of charge.
Yeah, I unfortunately not.
No.
Dermatology unfortunately is relatively specialist, and the amount of knowledge you have to know from medical school just to become a foundation doctor is so vast that there's no real opportunity for that to be offered.
Someone's asked about my hairline. Now, you've talked about, was it minoxidil you mentioned?
Yeah,
Yeah.
yeah.
So will that help for the hairline? First of all, you might as well just explain what minoxidil is.
So minoxidil is a topical drug that was typically designed for hypertension, but it's found to be used effectively for hair. It's in two forms. It's a tablet or a foam. Quite commonly is advertised on TV as Regain. It's known to promote hair growth where the hair is still active. It doesn't replace any hair that's been lost, but the hair that's been there, the hair that's still there, it sustains its longevity. The downside of minoxidil is that if you stop using minoxidil, your hair will go back to how it's meant to be. So it's only as good as the time you use it for. In terms of your hairline, it fundamentally depends whether or not you naturally recede. If you naturally recede, then there's not a lot we can do once it's receded. You can do hair transplantations, etc. But if it's still a bit thin and it hasn't completely gone away, minoxidil may be a way to keep what's there still there. but there's no real way to recover anything that's lost unless it's an inflammatory process that can be reversed.
There's a question here about heat straightening practices. So they're asking, what heat straightening practices should you adopt to prevent hair loss? I've read the question as it is. I find
Okay.
that it probably needs to be two separate things.
Yeah. So I think heat doesn't cause hair loss, but heat can break hair, if that makes sense. So like I mentioned, our hair is tightly coiled and it's a bit more fragile. So you can just use more kind of heat protective procedures to reduce that kind of risk of breakage to the hair.
Okay, there's a question from YouTube. So I think perhaps the listener might have, because I think you've answered this one already about does braiding cause hair alopecia? And you've said about the smaller it is, the more tension, but then
Yeah.
if it's bigger, then it's a different area and it's heavier. So there is but anything, if you pull your hair, basically what it braids are doing is putting traction on your hair. And if you pull anything hard enough, the hair will come out. So
Exactly.
I think that answers that. But this is a question for, I don't know whether you endorse any particular products, but what kind of conditioner is good for Afro-Caribbean hair?
So I personally will not tell you what conditioner to use. However, if you look at conditioning products, look at what they contain. If they contain stuff like argan oil, herb oil, shea butter, castor oil, all these things can have good effect. Um, and if you think about what you want from your hair, so if it's moisturizing or if it's just to prevent you probably relaxed it and you still want to give it a bit more support, then again, look at those kind of products. Um, there's lots of people who will give you reviews about what's effective, what's not effective. But personally, it's definitely down to you what you
You've
use.
heard of Bantana oil? I haven't.
I
Bantana
don't
oil.
know. No,
Someone's put it in the chat that Bantana oil seems to be getting a lot of kudos. But
what's
I
in
think anything that's, so if you get an influencer to endorse something, it usually gets kudos. And I think
yeah.
we sometimes have to guard it. I've never heard of it. I don't know whether it's good. I'm not saying it's good or it's bad, but um, then the other thing that I think a lot of people will identify with this one, been a private question that when you go to the hairdresser, they always say, trim your hair to remove the split ends.
Mm.
And they say that every 6 months, but it's for some people, it seems as if just as you've managed to get your hair to grow, their hair come and tell you to cut it. What do you think about this?
Yeah. So you're right, trim it. I always get told off because when I grow my hair out, I need to get knots right at the end, and it's just because you're splitting nuts, split ends. Fundamentally, you need that whole kind of the whole regime of the leave-in conditioner, the conditioner during the week to maintain the hair is important. That reduces the amount of split ends you get. So you just need to get that regime right where you're you condition your hair throughout the week. So in Africa, what you mentioned in the talk, I guess, was in Afro-textured hair like ours, then ideally you should probably condition your hair at least, I mean, let's say 5 times a week. I do 3 to 5 times a week. And that should help keep
That's looking good.
thank you. And that keeps the hair moisturized and reduces the risk of breakage and split ends. So develop a good routine, and the amount of split ends you have to do, the amount of haircutting you have to do will reduce. But it's fundamentally that commitment to your hair.
Okay. And the very last question I'm going to ask now is, because we're almost out of time, is if hair loss is being caused by an autoimmune disorder or by medication, how can you effectively manage this?
So this is it's quite a difficult question to answer because everything is a bit generic. Everything is a bit specific to the condition. I would say speak to your doctor. And if it's not a dermatologist you're speaking to, and then ask them to if they can seek advice from the dermatologist within their trust or within their hospital, and they can often lead to some tailored advice for you.
Thank you so much, Dr. Chiedu. That has been excellent. I myself have gained quite a lot from this morning. And thank you for those of you that have joined us. And I'm now going to hand over back to the CAHN team. But thank you so much.
Thank you.
Thank you so much for that. Can you all hear me?
Yeah, we can hear you.
Can.
Yeah, thank you so much, Dr. Chiedu, and thank you so much, Dr. Ngozi. And next week, we're having a topic called When Love Hurts, the hidden cost of toxic relationship. And it will be Dr. Joseph Omofuna coming in. Apologies, I'm unable to share my screen. I don't know if anyone else has a screen to share.
Okay, yeah.
Thank you so
please
much
just
for
wait
that.
a second for us to share the screen. 1 second.
Thank you. All right. So next week we have When Love Hurts, the hidden health cost of toxic relationship, and would like everyone to join as well, because it will be Dr. Joseph Omofuma, and he is well versed on mental health and relationship health. And we have Black Healthcare Awards coming in the 12th of July. Nominations are open already, and they've been extended till the 20th of April. If you know anyone, I'm sure everyone here possibly knows some healthcare professionals that they probably admire, put them up for nominations, let them be recognized. All shortlisted and finalists of these awards get drinks reception at the Parliament, and even at the event, they get recognition. Everyone gets recognition. Everyone gets to network with pioneers. So it's good to have them there. Nominate the ones you love, the ones you admire, the ones that are your heroes. We have the focus group for young adults and young people. Please scan the QR code to apply with their remuneration. It's about £35 per person. Please scan, share. If you know any young person, get them to join. It's about epilepsy, and this is all about getting our clinical trials, getting data from the young people in our community. Share within your network, share within parents you know, share within the youth organizations you know. Green and Art and Wellbeing Services is one of the services CAHN does, and is every Wednesday and Tuesday. Wednesday at Bolton and Tuesday at Stockport. It's done by our colleague Lola. If you have any information or you want to inquire about it, please send an email to greenandartswellbeing@CAHN.org.uk or call the number there. And you can contact Lola. You can just ask for Lola and she'll be able to guide you through. Thanks so much, everyone, for joining us today, and we hope to see you every Saturday. Take care. Bye.
Welcome to our Caribbean and African Targeted Health Improvement Programme, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk.